Great day, world. My name is Riel Wilmot. It is February 17th, 2022. This is a new show, a new segment, calling it Dose of Rielity. Thank you so much for joining me, and let's get started. So I am going to share my screen. All right, so this is a podcast research show, using it as a platform to share the research that I have been going through over the past pretty much lifetime. But specifically, this project is, as you can see here, I have created a PowerPoint presentation. This one is 160 slides, with the goal of chronicling the pandemic. And we are going to be using Manitoba as a case study. So the goal with this is to cover the basic concepts of basic questions of journalism: is who is involved, what has happened, where has this taken place, when did this happen, why did this happen? So I will be showing you the chronicles of the pandemic through the lens of Manitobans, referencing CBC articles. So pretty much everything that you're going to be seeing in this presentation is in direct result of the story we've been told about the pandemic from the CBC, which is the Canadian Broadcasting Corporation. The CBC is taxpayer money, it's government funded, and we will be analyzing a lot of sources. We will be analyzing news segments, and I will try to be objective, but I am doing this project because I believe that we were not being told the truth, and there's a lot to get into. So before I get started, I do just want to say thank you to anyone and everyone that is watching this video. Thank you to Dave at Generation Zed and the entire community we have been building. Please check us out at Generation Zed Podcast. This specific thing that I'm doing here is my own research project I'm presenting, but it would not be possible without the Gen Zed community. So you can find us on YouTube at Generation Zed Podcast, as well as Patreon, where we can talk about stuff that doesn't get censored. I will be having my own YouTube channel called Dose of Rielity, and I also have a segment that we just started with Generation Zed called Dose of Rielity. And as the time I am recording this, it's February 17th, 2022. We just put out an episode this past Sunday where I actually explained connections that I have found with the current Premier of Manitoba, Heather Stephenson, and explaining how she has direct connections through policies that she has implemented before she became the Premier, having the connections to the global octopus that we can refer to as the orchestrator of what has been the pandemic response. And in order to avoid being too conspiratorial, I am using official mainstream news sources, and mainstream scientific sources to lay a foundation for what we have been told, because there is a lot to understand with the pandemic. So thank you for my preamble here. But so as a lot of you, sure most of you know that it's February 22nd and the Canadian government is pushing for the Emergency Measures Act. So now is a time for me, I think, to share and help us collectively understand how we got to where we are right now. So like I said, this PowerPoint has 160 slides. I have another one right here that is actually 340 slides. So I have a lot of content to review, but don't worry, I will try my best to stay on point and not stray too far from my objectives and stay in order with ideas I want to present. So thank you again. I love you all, and let's get started. So in this presentation, today specifically, my goal is to lay the foundation for understanding what the PCR tests are. And in order to get started with this, okay, I said to myself, let's go to slide 38. So in order to understand how we got to where we are with the pandemic, I am going to look at slide 39. So we are looking at an article from March 10th, 2020. If anybody in Manitoba remembers these days. And let's just get my red pointer out. Okay, so March 10th, 2020, Manitoba reported its first COVID-19 case. The story is March 10th, 2020, and the subheadline is Manitoba reported its first case of COVID-19 on March 12th. Manitoba is under a state of emergency as the province fights the COVID-19 outbreak. Provincial officials announced March 12th they had identified Manitoba's first probable case of the illness caused by the coronavirus. On March 27th, the province announced its first COVID-19 related death. On Monday, officials announced the sixth COVID-19 related death in the province. Public health officials announced two new cases of the disease on Wednesday. Okay, so the second part of this article is talking about presumptive case. Brent Roosen, the chief medical officer of the province of Manitoba, Roosen said officials were notified of the first presumptive case Thursday morning. The article goes on to say it was expected that Manitoba would eventually have a presumptive case and processes were in place to rapidly identify it, he said. He asked all returning international travelers to self-monitor for symptoms and anyone coming back from Italy, Iran, or China's Hubei province to self-isolate. Okay. City and provincial and management offices are working together to monitor the spread, Winnipeg Mayor Brian Bowman said at a news conference. Working together to monitor the spread. Manitoba Premier Brian Pallister said the province is considering taking measures at the legislature and in Crown corporations to contain the virus, although he didn't provide details. Okay, we go on. March 12th, 2020. We've got the second and third presumptive cases of coronavirus in Manitoba. The first presumptive case, a woman in her 40s who traveled to the Philippines. She's in stable condition at home. There are now 3 presumptive cases of COVID-19 in Manitoba. Okay, so we've got presumptive cases. And in this article as well, we're going to continue. Should I be worried? You should be responsible and informed. You should not be panicking, said Dr. Brent Roosen, Manitoba's chief provincial public health officer. Manitoba's healthcare system was expecting and prepared for the arrival of COVID-19. I want to be clear that we are not helpless against the virus, Roosen said on March 12th while announcing the first case. Fear and panic will not help COVID-19, but our preparedness and credible information will. The province asks you to wash your hands often, cough or sneeze into your sleeve, avoid touching your face, and stay home if you're sick. You must also practice physical distancing. Gatherings of more than 10 people are no longer allowed as of March 30th, and you should stay 2 meters away from others in public. Okay, so let's go to understanding what it is that the PCR tests are. So as we saw, they were telling us about a presumptive case using the RT-PCR test. So we've got a reference here from Public Health England, understanding the cycle threshold in SARS-CoV-2 RT-PCR. The important message that they want to send out is the cycle threshold, the CT, is a semi-quantitative value that can broadly categorize the concentration of viral genetic material in a patient sample by following testing by RT-PCR as low, medium, or high. That is, it tells us approximately how much viral genetic material is in the sample. A low CT indicates a high concentration of viral genetic material, which is typically associated with high risk of infectivity. A high CT indicates a low concentration of a viral genetic material, which is typically associated with a lower risk of infectivity. So we have a high CT and we have a low CT. CT is cycle threshold. In the context of an upper respiratory tract sample, a high CT, in the context of an upper respiratory tract sample, a high CT may also represent scenarios where a higher risk of infection remains. For example, early infection, inadequately collected or degraded sample. Sorry, let me just zoom in. This was a comment that I had from one of our Patreon members that my font is too small. I apologize. I have a lot of information that I want to share. So we could zoom into 148% here. So CT values cannot be directly compared between assays of different types, but not all laboratories use the same assay and some use more than one. What is an RT-PCR? The reverse transcription polymerase chain reaction is an established laboratory technique that can be used to identify the presence of a specific genetic material through a biochemical process of amplification using enzymes and is based on a specific target recognition. Genetic material includes DNA and RNA. Genetic material includes DNA and RNA, but in the context of RT-PCR, it is RNA that is detected. SARS-CoV-2 has an RNA genome. The major benefits of RT-PCR are in the ability to detect extremely small amounts of pathogen RNA in a very short time. RT-PCR has therefore revolutionized the speed and sensitivity of clinical diagnostics and can be adapted to test at large throughout using automation with reduced need for technical expertise. Modern applications of the RT-PCR allow the reaction to be monitored during each stage, known as the RT-PCR. So here we have a graph from Public Health England, RT amplification cycles. As they are showing here, you got the cycle number, cycle threshold at 25.6, and this bar is going up, and here we have a plateau phase. We will explore what this means right away, but let's just keep that in mind. So we have part 2 of this chart. RT-PCR detects presence of viral genetic material in a sample, but is not able to distinguish whether infectious virus is present. Let's just read that again. The RT-PCR detects presence of viral genetic material in a sample, but is not able to distinguish whether infectious virus is present. The quantity of intact virus in upper respiratory swabs will be affected by factors that are endogenous and exogenous to laboratory methods. Just for a third time, sorry if I'm repeating myself. However, I think this is an important line that they themselves highlighted. The RT-PCR detects presence of viral genetic material in a sample, but is not able to distinguish whether infectious virus is present. What is a CT value? The cycle threshold can be defined as the thermal cycle number at which the fluorescent signal exceeds that of the background and thus passes the threshold for positivity. A typical RT-PCR assay will have maximum of 40 thermal cycles. The lower the CT value, the higher the quantity of viral genetic material in the sample as an approximate proxy for viral load. CT values obtained in this way are semi-quantitative and are able to distinguish between high and low viral load. A 3-point increase in CT value is roughly equivalent to a 10-fold decrease in the quantity of viral genetic material. So I think that this means that a 3-point increase, so if you're going to go from 24 to 25 in the cycle threshold, that means that you will have 10 times less quantity of viral genetic material you will be able to see. So here we have another cycle, pretty much showing the exact same thing that we looked at on the previous slide. Cycle threshold 25.6. So it seems like 25.6 is that magic number where maybe once you have a higher cycle, then it produces significantly less genetic material. And there seems to be a plateau here with relative fluorescence. Okay, so let's go on to our next explanation of the PCR tests. Here we have from clevelandclinic.org, different types of PCR tests, September 15th, 2021. Understanding the different types of COVID-19 tests. Do you know the difference between a molecular test and an antigen test for COVID-19? To better grasp how these tests work and their main differences, we spoke with pathologist Brian Rubin, MD, PhD. What type of COVID-19 tests are there? There are currently two primary types of COVID-19 tests also being used to test patients for COVID-19. Molecular tests, also known as nucleic acid, RNA, or PCR tests, and rapid antigen tests. A molecular COVID-19 test. Molecular. Now, friends in Canada, remember this word, molecular. Molecular COVID-19 tests, according to Dr. Rubin, are more sensitive and specific than antigen tests, making them more accurate than antigen tests. They're frequently performed by testing a swab of specimen taken from the patient's nose. What molecular tests do is look for and detects the RNA or nucleic acid component of the virus, says Dr. Rubin. That's opposed to the antigen tests, which are looking for the proteins from the virus. So first, PCR stands for polymerase chain reaction. Okay, so that is consistent with what the Public Health England says, polymerase chain reaction. This is a way of amplifying the nucleic acids in your sample. According to the FDA, the polymerase chain reaction converts any virus RNA in your sample into DNA and amplifies it by making millions of copies of the DNA, which the molecular test can then detect. So the FDA says any virus RNA in your sample into DNA, the polymerase chain reaction converts any virus RNA in your sample into DNA and amplifies it by making millions of copies of the DNA, which the molecular test can then detect. Okay, what is the next slide I want to be looking at? Okay, let's look at this one. So here we have reference from a July podcast, July 16th, 2020, a podcast called This Week in Virology. You can click on YouTube, this link right here. I can share it in the description and you can look for yourself. In this video, Tony Fauci makes a point of saying the PCR COVID-19 test is useless and misleading when the test is run at 35 cycles or higher. A positive result indicating infection cannot be accepted or believed. July 16th, 2020. So this article, these words are written by the website itself, antiempire.com. These are not my words. These are the words of this website, the author. But in this YouTube, I took the screenshot of this YouTube video and I put subtitles on. And the subtitles for this segment at 5 minutes and 8 seconds, he says, 38, even 36, you got to say, you know, it's just dead nucleotides. So as the writer of this article from Anti-Empire says, and I know it's not CBC, and I said that we're going to be looking at CBC, but this is just to lay the foundation. We will be looking at primarily CBC articles to get us some references, but this is this interpretation is, I think, important. So it says, too many cycles and the test will turn up all sorts of irrelevant material that will be wrongly interpreted as relevant. That's called a false positive. So what Fauci failed to say in the video is the FDA, which authorizes the test for public use, recommends the test should be run up to 40 cycles, not 35. And that's all I'm going to reference from that website. So keep that in mind. The FDA says 40 cycles, not 35. Now, is that true? Well, now I'm going to flip to, this is a press release from the JCCF, and they are the Center for Justice Center for Constitutional Freedom. So they are the lawyers that have been representing the plaintiffs that have been challenging government restrictions and lockdowns. So in Manitoba, there is a 9-day trial that happened. There was also a trial in Alberta and in British Columbia, and I will be going deep into that trial here. But what we're going to look at right now is the press release from the Justice Center themselves. And we also will be looking at the CBC articles talking about the trial, but this is the press release from the Justice Center from May 11th, 2021. Let me zoom in here for our folks. And okay, 154. So, Manitoba chief microbiologist and laboratory specialist says 56% of positive cases are not infectious. So that's okay. Let's proceed. What do they mean by that? So, yeah, May 11th, 2021. So, as the press release says, the Justice Center represents churches and individuals who are challenging government lockdown restrictions in the Court of Queen's Bench as unjustified violations of the Charter freedoms to associate, worship, and assemble peacefully. The hearing commenced on May 3rd, 2021, and is continuing this week. The onus is on the Manitoba government to justify its restrictions on charter rights and freedoms as being reasonable, necessary, and beneficial. My apologies there. One of the crucial issues in this trial is the operation and reliability of the polymerase chain reaction test that is used by governments across Canada, including the Manitoba government, to diagnose COVID and measure its spread. So it says, to get enough genetic material to test, the PCR process increases the genetic material present by copying it and then copying it again, over and over. Each of these increasing steps is called a cycle, and the genetic material in the solution is reacted against the reference DNA to determine a positive. If the sample contains a large amount of COVID virus, it will react positive after only a few cycles, while a sample with small amounts of genetic material will require more cycles to amplify enough genetic material to get a positive result. Since the PCR test amplifies traces of COVID-19 through cycles, a lower number of cycles needed to get a positive suggests the presence of a higher viral load for the person being tested, and therefore a higher contagion potential. The number of cycling required to identify viral material in a given sample is called the cycle threshold. So, the Justice Center's expert medical witness, Dr. J. Bhattacharya, a world-famous epidemiologist and professor of medicine from Stanford University, and Dr. Thomas Warren, infectious disease specialist and medical microbiologist, both provided evidence that the PCR test is unreliable in determining whether a person is infectious with the actual COVID-19 disease. Chief microbiologist and laboratory specialist Dr. Jared Bullard is a witness for the Manitoba government in this hearing. Questioned under oath by Justice Center lawyers on Monday, May 10th, Dr. Bullard acknowledged that the PCR test has significant limitations. The head of Chatham Provincial Laboratory in Winnipeg, Dr. Bullard admitted that the PCR tests do not verify infectiousness and were never intended to be used to diagnose respiratory illnesses. Dr. Bullard testified that PCR tests can be positive for up to 100 days after an exposure to the virus, and that PCR tests do nothing more than confirm the presence of fragments of viral RNA of the target SARS-CoV-2 virus in someone's nose. He testified that while a person with COVID-19 is infectious for a 1 to 2 week period, non-viable, aka harmless, viral SARS-CoV-2 fragments remain in the nose and can be detected by a PCR test for up to 100 days after exposure. So he testified that a person with a COVID-19, that while a person with COVID-19 is infectious for a 1 to 2 week period, non-viable viral SARS-CoV-2 fragments remain in the nose and can be detected by a PCR test for up to 100 days after the exposure. Dr. Bullard testified that the most accurate way to determine whether someone is actually infectious with COVID is to attempt to grow a cell culture in the lab from a patient sample. Cell culture in the lab from a patient sample. If a cell culture will not grow the virus in the lab, a patient is likely not infectious. A study from Dr. Bullard and his colleagues found that only 44% of PCR tests would actually grow in the lab. Dr. Bullard's findings call into question the practice used in Manitoba and elsewhere in Canada of the results of classifying positive PCR tests as cases, which implies infectivity. Equating positive PCR tests to infectious cases, as so many provinces have done over the course of the past 13 months, is incorrect and inaccurate, according to this Manitoba government witness. Dr. Bullard's findings call into question the practice used in Manitoba and everywhere else in Canada of the results of classifying positive PCR tests. Oh, sorry, I just read that. My mistake. Still getting new to all of this. Okay, so we can continue on to the second part of this press release about PCR tests regarding the legal trial in Manitoba from May 2020. So as well, we proceed. Dr. Bullard acknowledged that he had been closely studying the correlation between cycle threshold value and infectiousness since at least May 7th, 2020. Dr. Bullard acknowledged that Manitoba has known for some time that a given PCR test CT value is inversely correlated with infectiousness. This means that testing for COVID at higher threshold levels can result in false positives, as explained in this article. Even the World Health Organization notes that careful interpretation of weak positive result is needed. Weak results are those run at higher thresholds. For example, someone with a positive PCR test that is run at 18 cycles is more likely to be sick and infectious than someone who has a test run at a cycle CT value of 40. So this is exactly what Anthony Fauci said in July 2020, and this is exactly what the Public Health England says, with this cycle here at 25.6 basically being the threshold. However, Fauci says 35 cycles or higher. So his numbers are even a little higher than what we're evaluating here in the court. So we're going to continue on. At the very end of all of this, so the press conference, the press release is already already talking about things that we've already covered here. So I don't need to repeat myself too much, but I do think repeating myself enough is necessary, is important, because this is the foundation for the entire pandemic are these tests. And we have the evidence brought up in court from the expert witness testimony from the provincial government, even admitting that the tests are basically invalid. So let's go into this last paragraph here. Finally, it should be noted that some Canadian news agencies have quoted Dr. Bullard as testifying that a positive PCR test indicates infectivity 99.9% of the time. This is incorrect. Rather, Dr. Bullard testified that a PCR test will detect any viral that is present in a sample 99% of the time. However, Dr. Bullard testified that determining whether or not a sample is actually infectious, containing a viable virus capable of replicating, needs to be confirmed by a lab culture. As noted, only 44% of the, quote, positive samples using a CT of 18 returned a viable lab culture. Samples tested at a CT of over 25, according to Dr. Bullard's report, produced no viable lab culture. So I'm actually going to backtrack a little bit and go back up to this earlier, just this paragraph above here. So both Dr. Bullard and Manitoba Chief Medical Officer Brent Drosten confirmed under cross-examination that CT values are not provided to public health officials by laboratories. Dr. Drosten admitted that he could mandate that the CT value be provided to him, but he has not done so. So just, I wonder what happened. How was Brent Drosten able to admit that he basically said, I could have looked at what the cycle thresholds were, but I chose not to. And I didn't mandate it. Sure mandated a lot of other things though. Yeah, so that's just a clip of something I'll be going a lot deeper into in the future with this specific trial that happened in Manitoba. I'm not going to spoil it. I'm not going to tell you right now how the trial ended up going, but you can probably guess what the eventual verdict was. But again, that's a deep one that we're going to go into. So another thing that we're going to be reviewing, the World Health Organization information notice for IVD users. So from December 14th, 2020, we're looking at the product type, which is the nucleic acid testing, NAT, technologies that use real-time polymerase chain reaction for detection of SARS-CoV-2. The purpose of this notice is to ensure users of certain nucleic acid testing technologies are aware of certain aspects of the instructions for use, which is the IFU, instruction for use for all products. Let's zoom in on the font a little bit. It's a little bit too big. Okay, here we go. So in this notice, it says, as with any diagnostic procedure, the positive and negative predictive values for the product in a given testing population are important to note. As the positivity rate for SARS-CoV-2 decreases, the positive predictive value also decreases. This means that the probability that a person who has a positive result, SARS-CoV-2 detected, is truly infected with SARS-CoV-2. I'm going to reread that. This means that the probability that a person who has a positive result, or SARS-CoV-2 is detected, is truly infected with SARS-CoV-2 decreases as a positivity rate decreases, irrespective of the assay specificity. Therefore, healthcare providers are encouraged to take into consideration testing of results along with clinical signs and symptoms, confirmed status of any contacts, etc. So this is just another example of explaining that users of RT-PCR reagents should read the IFU carefully to determine if it's if the threshold is necessary to account for any background noise, which may lead to a specimen with a high cycle threshold value result being interpreted as a positive result. The design principle of RT-PCR means that for patients with high levels of circulating virus or viral load, relatively few cycles will be needed to detect a virus, and so the CT value will be low. Conversely, when specimens return to a high CT value, it means that many cycles were required to detect virus. In some circumstances, the distinction between background noise and actual presence of the target virus is difficult to ascertain. Thus, the IFU will state how to interpret specimens at or near the limit for PCR positivity. In some cases, the IFU will state that the cutoff should be manually adjusted to ensure that specimens with high CT values are not incorrectly assigned SARS-CoV-2 detected due to background noise. Okay, so again, we just have multiple sources saying the same thing, that when there's a higher cycle threshold of these RT-PCR tests, you can basically increase the results of what you're looking for, or increase the chances of having a false positive. So we've looked at Anthony Fauci, Public Health of England, Cleveland Clinic, and one thing we're going to now be looking at the CDC. So from the 7th month, 21st day, 2021. So that is July 21st, 2021. Lab alert, changes to the CDC RT-PCR for SARS-CoV-2 testing. So the audience is anybody that's performing COVID-19 testing. After December 31st, 2021, the CDC will withdraw the request to the U.S. Food and Drug Administration, FDA, for emergency use authorization of the CDC 2019 novel coronavirus real-time RT-PCR diagnostic panel. The assay first introduced in February 2020 for detection of SARS-CoV-2 only. The CDC is providing this advance notice for clinical laboratories to have adequate time to select and implement one of the many FDA authorized alternatives. So effective right now, because it's February 17th, 2022, in America, the PCR test is not authorized to be used because they were only using the RT-PCR test through the emergency use authorization, which, as we will get into in later presentations, I'm sure a lot of you know, is that that's how they were able to fast track the boop boops, is through the emergency use authorization. Oops, okay, so that's pretty much all this one is. It's just a lab alert to tell people, hey, you have time to prepare. So when we want to continue using, we're going to have to find different ways of finding tests to tell people that they are infected with something. So, okay, so now now this is going to be a little backstory into the RT-PCR tests. And I don't know how many of you folks know this, but let's actually flip over to this other presentation here. Give me a moment, folks, but I have a slide that I want to reference that I did not put in this one. A lot of these are the same. As you can see, I have 340 in this one, and then I took the 340 out of the 340. I tried to make it more coherent and concise. So I'm starting with the PCR tests, and we'll be going through all of these. These are all of the CBC articles that I have, and but there's one specific one I want to find from May 2020. So just please bear with me, much appreciated. As you can see, I've got a lot. I'm going to have a lot of time going through all of these and talking with you folks. Again, thanks for being here. This is Dose of Rielity. You can also find us on Generation Zed Podcast, where I am a contributor to the research, as well as I've become a co-host with some of our interviews, and we have a new segment on the Patreon called Dose of Rielity. So that's kind of where I'm getting my foot in the door with all of this. Yeah, we're almost there. January, okay. I guess I could have included that as well. The slide that I'm trying to find is here. We're very close. This one here. So this is, this is an article from May 10th, 2021. So this is an article around the exact same time as the press release that we just looked at. And so in this, I've included this slide here, this picture, in addition to the slide of the news reporting that the accuracy of the PCR tests are being challenged. So it's talking about how the tests are, so in the news, CBC article says the tests are considered the gold standard for COVID-19 testing, but are not perfect and can produce false results. This is the headline of that article, says Manitoba's former doctor hesitant to call all pandemics difficult. Interesting. And we will get into that, don't worry. Because just a side note is the former health minister of Manitoba testified in that trial, because he's been very outspoken in regards to how the government has handled the pandemic. So accuracy of PCR tests being challenged. Buller testified that Kadam Labs isn't looking at CT values in a systemic way for tests. CT value indicates an estimate of how much virus was likely in a sample to start with. So last week, Kettner's successor, Dr. Brent Drosten, said the PCR tests have accurately predicted future levels of hospitalization in Manitoba. Okay, we won't get into that. But the point of this one is Kary Mullis. He is a Nobel. He's unfortunately passed away. He passed away August 2019. He is a Nobel Chemistry Prize winner. He invented the PCR test, the original PCR test. And this YouTube video is headlined, Kary Mullis explains why his PCR test is not a diagnostic tool. How his PCR test is not a diagnostic tool. Interesting. The quote in this video, and there's a link to it right here. It's still up on YouTube. Actually, I haven't checked as of today, but when I did this, when I put this together in January, it was still up on YouTube. So he says that with a PCR, if you do it well, you can find almost anything in anybody. It doesn't tell you that you're sick. So that is consistent with what the World Health Organization says, with what Anthony Fauci says, with what the expert chief witness of Manitoba said in the trial, who testified under oath. Yet these tests were used to justify declaring a pandemic and being in a state of emergency. So how did that happen? Let's explore. So here we have Christian Heinrich Maria Drosten. So I just have to zoom out a little bit. So this is just copy and paste from Wikipedia. So Christian Drosten is a German virologist whose research focus is on novel viruses. During the COVID-19 pandemic, Drosten came to national prominence as an expert on the implications and actions required to combat the illness in Germany. Let's do a little bit of just a background check on this individual and why we're looking at him and why he came to national prominence. So on January 23rd, 2020, Drosten, along with other virologists in Europe and Hong Kong, published a workflow of he published a workflow of real-time PCR known as the RT-PCR diagnostic test, which was accepted by the World Health Organization and which sent kit tests to affected regions. So this individual, Drosten, was a member of the German Ministry of Health's International Advisory Board on Global Health, chaired by Ilona Kickbusch. Don't need to get too deep into that. We'll cover that in a later one, but I just wanted to explain to you the individual responsible for the RT-PCR test. His name is Christian Drosten. And as well, let's continue to show that on February 19th, 2020, Drosten, along with 26 other scientists, published as a co-author of the Statement in Support of the Scientists, Public Healthcare Professionals, and Medical Professionals of China Combating COVID-19, which declared, "We stand strongly condemn conspiracy theories suggesting that COVID-19 does not have a natural origin." So how has that aged? We will be looking at that in future presentations. The fact that the inventor of the RT-PCR test co-authored a paper which was a statement where they said, "We stand together to strongly condemn conspiracy theories suggesting that COVID-19 does not have a natural origin." So, but just do I really want to continue with this individual here? Later on, I'm going to focus more on the individuals, all of the health professionals and the health experts involved with the pandemic on a global scale. So we won't go too deep into that, but just giving you some information on that person's background there. You know, he's been in the disease control thing for quite some time. So let's go back to, oh yeah, no, here we are. Okay. So, okay, so remember, to my Canadian friends, I am in Canada. I'm actually in Winnipeg. So there is a reason why I'm using Manitoba as a case study is because I live in Winnipeg. I read the news. I follow deep, close attention to everything that's going on as best as I can. So I'm just going to pull this up here. So this is the Genetic Non Discrimination Act. It was assented to 2017-0504. What is the Genetic Non Discrimination Act? It is an act to prohibit and prevent genetic discrimination. An act to prohibit and prevent genetic discrimination. The following definitions apply in this act. To disclose means to include, to authorize disclosure. Genetic test. Genetic test means a test that analyzes DNA, RNA, or chromosomes for purposes such as the prediction of disease or vertical transmission risks, or monitoring, diagnosis, or prognosis. So it tells you who a healthcare practitioner and researcher is. Let's look at, so the prohibitions, the genetic test in this law, Canadian law. It is prohibited for any person to require an individual to undergo a genetic test as a condition of providing goods or services to that individual, entering into or continuing a contract or agreement with that individual, or offering or continuing specific terms or conditions in a contract or agreement with that individual. Here we have refusal to undergo genetic test. It is prohibited for any person to refuse to engage in an activity described in any paragraphs 1A to C in respect of an individual on the grounds that the individual has refused to undergo a genetic test. Disclosure of results. It is prohibited for any person to require an individual to disclose the results of a genetic test as a condition of engaging an activity described in any of paragraphs 3, 1A to C. So this law seems to say that you are not allowed to discriminate against somebody if you are trying to force them to take a molecular test. So just wondering, does that include the COVID-19 molecular test? And was that brought up in the Manitoba court trial, that there is a federal law prohibiting discrimination against genetic testing? I don't remember that being brought up, so we got some things to cover as well with that trial and with the JCCF. But I'm not a lawyer, not a health expert. I'm just somebody that's honestly, I like the term citizen journalist. That's all I'm trying to do. Even though even being a citizen in Canada right now is a little controversial. But let me just finish off with this Genetic Non-Discrimination Act. Offenses and punishment. Every person who contravenes any of sections 3 to 5 is guilty of an offense and is liable, on conviction, on indictment, to a fine not exceeding $1 million or to imprisonment for a term not exceeding 5 years or to both. Well, I suppose that this law doesn't matter when there's a state of emergency, but my problem with there being a state of emergency is that the tests, how we were justifying there being a state of emergency is using tests that can't actually tell you if somebody's infectious or what kind of sickness they have. So maybe I'm using the term incorrectly, but it seems like a bit of a catch-22 there. And yeah, so as I'm asking here, is the PCR test a molecular test? So is it legal to subject Canadians to the PCR test as per the Genetic Non-Discrimination Act? And we also saw, according to the CDC, that the RT-PCR test was only authorized under emergency use authorization. So I think that is enough. Well, you know what, just for kickers, I'm going to go with this one as well, because I want people to kind of really understand like the conclusion that I kind of want to be hammering home with all of this. And so we're going to be looking at this article right here. And sorry, I haven't been keeping track of the time. I don't know how long I've been going for, but I'm going to try to wrap it up after I do this, after this slide here with the PCR tests. And then I'm going to continue on. This is going to be a compounded presentation. So for example, I only covered the 19 slides here today. I've got 164 to go through, and then I've got another 340 to go through, and I'm just going to keep on doing it. And I plan to just keep on doing this. So again, thank you very much for being here. I'm almost done with this presentation right now. So this is from, do I even have a date on this one? I don't, but 2021, so the 7th, so July 2021. I'm gonna, for the sake of censorship and all that, I'll try to be discreet with this, but Dr. Tom Cowan and Dr. Andrew Kaufman on the SARS-CoV-2 isolation and genetic sequencing. So what does that mean? So Dr. Tom Cowan and Andrew Kaufman have again published another very informative video discussing how the fraudulent process of the so-called virus isolation and genetic sequencing has been done for the SARS-CoV-2. Sorry, just gonna grab some water here. fraudulent process of the so-called virus isolation and genetic sequencing has been done for the SARS-CoV-2 by the institutions upholding the official narrative of this fake pandemic. Fake pandemic. Sorry, that's just an opinion. This is written by James Herrer, and I will show you the link to that right here. So from Web Life. So in the episode that this author is referencing, the two explained how unscientific the current process is for finding a pathogenic virus, as the scientists responsible cannot really demonstrate it following the proper way of isolation, purification, identification, and characterization of a so-called infectious agent. At the beginning of the presentation, Dr. Cowan articulated that the proper way of maceration, filtering, and ultracentrifugation has never been done, not only in SARS-CoV-2, but with any so-called pathogenic viruses. This paragraph is going to be touching on a much bigger topic. I don't want to get into that right now, but we will be reviewing and coming back to Dr. Tom Cowan's work and Andrew Kaufman. So he continues to say, though, that all 58 governments agree, and 15 different institutions like the CDC, the Robert Koch Institute, and the Pasteur Institute all agree with that. They say that this is not how we find viruses. We cannot look in any fluid of any sick people and find identical particles that we would properly call viruses. There's also reference to Dr. Stefan Lanka, who, if you haven't heard of him and you're interested in an alternative interpretation of virology, definitely recommend looking into his work. Haha, here, this is what I was looking for. So, Dr. Cowan then claimed that through Freedom of Information request, they have asked for the scientific paper describing the isolation and purification and characterization of any SARS-CoV-2 virus from any human being with so-called COVID-19 from 58 different government health agencies, but none of those agencies provided the paper until now. Not only that, according also to him, they have also requested the same document for HIV, Zika, Ebola, and measles, and yet none of the institutions can provide that document. Interesting. So they are requesting for the hard proof and evidence of the isolated SARS-CoV-2 viral sequence that allegedly the RT-PCR tests are programmed to be looking for. And 58 government agencies seem to have actually not been able to provide the evidence for. So yeah, so let's just keep that in mind, that there were scientists that had been asking for proof from the governments to show that there is an isolated SARS-CoV-2 virus particle. And according to his request through 58 different government agencies, none of the agencies have provided it until now. But what does it mean that they provided it now? So we're going to look into that. We're going to continue that one. But from other things that I've looked at that I don't have them right here, governments haven't actually been able to show it. I've seen footage from Ireland, from Alberta, and just to name a few. But again, we're going to go into that later, because that is a much bigger topic. The only thing that I wanted to get across with this is to help us understand that the tests that the entire pandemic, the tests that the entire pandemic was based on, the foundation of an international health crisis, were based on these RT-PCR tests that Kary Mullis, the inventor of the PCR test, said you cannot actually it doesn't actually tell you that you're sick. We have evidence from from Anthony Fauci himself saying that if it's the test is at a certain cycle threshold, it's useless, it's invalid. We have evidence from the Manitoba professional expert witness, Dr. Jared Bullard, that and Brent Rusin, that they don't know what the cycle thresholds were. I'm pretty sure that we actually found out that they were set to be 40, but that's just what I will confirm with that in a future presentation. I'm going to remember that I said that, but I'm pretty sure I read that. We also have the CDC explaining that the tests were only authorized for a limited period of time. And it's like, well, maybe that they authorized them just for the limited period of time to push something that we will be looking into in future slides that I don't want to talk about too much right now. And so I'm going to wrap it up here. Sorry for getting a little rambly. I'm going to improve my organization. I just want to say thank you very much for tuning in. Again, this was a dose of Rielity. I am a contributing researcher, citizen journalist with Generation Zed Podcast. You can find Generation Zed Podcast on YouTube. Just go to that, just type that in. And then we also have Generation Zed on Patreon. That's about it. That's all I've got for right now. Well, actually, I have a lot more, but I'm going to wrap it up now to not digress and spend too much of your time. But thank you very much. Thank you so much for listening, and hopefully that you have learned something, and please give me feedback. I'm just starting and looking to grow this whole operation. So thank you very much and have a great day.